After my training in the US, I wanted to write a paper. Dr. Wilson taught me how to write a paper, and he was keep pushing me, Sean, you have to do the academic work. Otherwise, you won't be able to be a good surgeon. He was keep telling me that. Now, I was able to do it because I was doing something different than they do in the US because of different settings of the practices. Here in US, you have to do all the surgery in the surgery center. You can't have your own. It's too difficult. But in South Korea, you can't have the privilege to use a surgery center. You need everything on your own. So I prepared my own OR, my own surgical staffs. I prepared everything by myself. I had to do many of the cases in the office settings, so-called. So I had to do it on the local. I wanted to do it on the local.
And that was your thing at the time?
That was my thing at the time. And then I was doing it the scrotal approach on the local, but Dr. Wilson saw a subcoronal approach of the Dr. Robert Valenzuela, and then he thought, oh, this may be good for Sean. So he brought Dr. Valenzuela to my practice and taught me how to do subcoronal. Then I combined these techniques. So I was doing something different. Now I have something to tell. I was able to talk about something. And then writing a paper wasn't that difficult. Writing a paper was kind of fun, kind of excitement. And as I would travel here frequently, and they know that I do some cases, they were inviting me for the other multi-institutional studies as well.
Right.
And they were asking me, Sean, why don't you try the mini pipette with us? They invented a new technique. They wanted me to join the group to present a paper about it. That's how I was slowly transitioning from just a private guy to a academic interested guy. I can say that I'm academic oriented because my setting is a private. Now, what happened to me, the other thing is that money wasn't the only thing. I wanted to be a doctor who makes a lot of money, but when I was at that point, oh, geez, this is not what I wanted to do. It turns out that making money lose its meaning very quickly once you reach a certain point. As I, look back of my past, now I can see that I wanted something else. But back then, I didn't know that I wanted something else. So when I went back to Korea, it's such a paranoid atmosphere among the doctors. They really didn't want to train each other because it will mean that you will create your own competitor after you train them, right? So they were fearing. Nobody was training each other. Dr. Wilson came over and see how I was doing. I was strictly forbidding any of my techniques to be revealed by the others. I was in paranoia. And he came over and kicked my ass again. You are good now, but you won't be a great surgeon afterwards. To be honest with you, I didn't believe him in the first place. I attended his life, achievement award, and it turns out that it was the same for him. When he first got trained of the prosthetics, back then, nobody in US was willing to train others who lives in the same area.
For the fear of competition.
Correct. But he was the only one, the first one, who trained others, no matter where they come from, no matter what they are, what they do. He trained every other surgeons if they wanted to. So he's a pioneer in terms of the training. I really didn't want to reveal my secrets of the surgery, right? He told me, Sean, you shouldn't. Then I was making videos about how I do the local anesthesia or the subcoronal approach, of course, and I submitted as a video journal or the papers, abstracts, and coming to the meetings, presenting about that, getting harsh questions about it. Guess what? Throughout the courses, I was able to develop my skills better. So I was kind of half convinced that, maybe this training will make me better in my surgery. That's how I was willing to train the others. That's the first step. I was training the others, not for them, but for me. I was now accepting anybody who come to my practice for the training. And then doctors from other countries like India or China or all the other countries were coming to my practice to get trained. Guess what? I really enjoyed training the others because it was not the training of them. Actually, that session was training of myself. I had to explain every steps, what I do, what I did, and everything I was able to look into it again. Why do I do this process? Why do I edit it? Why don't I omit this one? Why don't I go that way? So then I got friends. Then I was able to talk with somebody else about the prosthetics. See, Ahmed, in South Korea, there's no one I can talk about my specialty because there are not many who does the prosthetics and the volume they do. At a certain point, you can't really understand what this guy's talking about because prosthetic urology is such a niche market, and not many are interested in it.
Correct.
So I can't really talk about academics. I can't really talk about the improvements or that delicate parts of our field. But if I come over, like this meeting in the US, so many of the doctors are prosthetic surgeons. I can talk about them, I can listen to them, I can understand them, and I believe I was able to be understood by the others. Then I had the feeling of the inclusion. Even though I'm from Korea, because I am doing the prosthetic urology, especially penile implants, now I am one of them as a band of brothers who do the prosthetics. That's why at the first sight of you or the Daniel Osmanov or Faisal Yafi, Mike Shea, we can become friends and brothers immediately.
Of course.
Because we have such a similar characteristics. And the personalities. One of the things I really enjoy as a prosthetic urology surgeon is that now I am included in that small society, which was very hard to find, of course, in the first place. But I'm so happy that I was able to be with the others.
And you find out that together we are stronger.
Correct.
And together we are better surgeons and better at what we do.
So Papa Wilson was right. If I wanted to do a good practice, I had to do academic work. At the same time, I had to do the training. All three things should be collaborated.
Correct.
It's a symbiotic thing. If you miss one of these legs, the stool will fall, and you have to attend the meeting. I mean, I did several, online meetings throughout the COVID, but it didn't work for me. No. I really didn't like it because in-person meeting is the only meeting I want, especially for the surgery. It's a great joy that I can travel again and see you in person, see the others in person, and doing this kind of interview. Because after all, I always believe that we surgeons should provide more information toward the patients so that they can choose a right guy for their own surgery. Getting a surgery is a scary thing because many people, their life changes after the surgery. So I always think that it will be the best of the patient interest if we can show them who we are before they come to our practice.
That's right.
We only have limited amount of time to talk with the patient. Okay. Even though we spend like an hour, patient can never know what kind of human being the surgeon is he's still talking with. That's why I do this kind of interview to show what kind of surgeon he is, what kind of person he is, so that his patients may have a better chance to understand him. I was in the patient position several times. I had 2 surgeries on my right knee. I believe that surgeons should suffer physically, and they have to be in the patient position to understand the patient aspects.
Correct.
Why they are suffering, what they want, what they need. Because otherwise, it's all about being a human, right? It's all about supporting the others.